If you had a stroke today and arrived at the hospital dehydrated, your chances of severe disability would be 5 times higher. But here's the paradox. For a different type of stroke, that same dehydration could actually save your life, reducing death risk by 13%. Same condition, opposite outcomes. Let me show you why and what you can do about it. This number, 5.16, holds a terrifying warning for stroke patients. It's literally an indicator showing the crossroads between recovery and deterioration. Research published in Frontiers in Neurology found that stroke patients who arrive dehydrated are 5.16 times more likely to be discharged with severe disability. What does severe disability mean? It means losing your independence. You can no longer cook your own meals, go shopping, or take care of yourself without help. Doctors diagnose dehydration through a blood test measuring the BUN to creatinine ratio. When it goes over 15, that confirms dehydration. Here's the simple explanation. BUN and creatinine are waste products in your blood. Normally, their ratio stays around 10:1. When you're dehydrated, your blood gets concentrated and BUN shoots up. That's how doctors know. So why does dehydration make strokes so much worse? Most strokes, about 87%, are ischemic strokes. Imagine the pipes in your brain getting completely clogged. A blood clot blocks the vessel to your brain. The oxygen and nutrients that should be going to your brain cells get cut off, and your brain starts to die. Dehydration makes this catastrophic. When you're low on water, your blood becomes thick and sludgy. Your heart struggles to pump it. Blood pressure drops. Even less blood reaches your already starving brain. It's a deadly domino effect. And here's what's even scarier. Research shows that even with the most advanced clot-busting drugs, if the patient's body is dehydrated, the drug's effectiveness drops significantly. Looking at the data, you'll be shocked. Even when everything else is equal, women are 3.6 times more likely than men to experience dehydration after a stroke. And as we age, our bodies store less water, our thirst signals weaken, and our kidneys can't conserve water as well. Now, if you've been listening up to this point, the solution seems pretty simple, doesn't it? Now here's where it gets strange. Doctors tried the obvious solution: give stroke patients more IV fluids. Everyone expected better outcomes. They were wrong. The REVIVE trial split patients into two groups. One side got standard IV treatment. The other side got much more, 20 milliliters per kilogram of body weight. So for a 70-kilogram patient, that's almost 1.5 liters extra. Results? The aggressive group did worse. Severe deterioration, 2.0% in standard care, 2.9% in the high fluid group. More water made things worse. How? The answer is brain swelling, cerebral edema. The brain's blood vessels are already damaged from the stroke. Normally, there's a very strict barrier protecting the brain. In medical terms, it's called the blood-brain barrier, and it's like a screen door on your house. A good screen keeps bugs out, but lets fresh air in. Your brain has the same thing, a protective barrier. But when this barrier breaks down from a stroke, excessive IV fluids just leak right into the brain tissue. Then the brain starts to swell. But here's the problem. The skull that houses our brain is made of hard bone with no room to expand. Eventually, brain pressure shoots up, causing even more damage to the brain. A vicious cycle begins. REVIVE's message was clear. In acute stroke, more water isn't the answer. Every patient needs careful, individualized fluid management. Now the story flips 180 degrees. In fact, what just killed one patient might save another. Stay with me. This is where it gets mind-blowing. There's another type of stroke, hemorrhagic stroke. Literally, the brain blood vessel isn't blocked, it completely bursts open. Blood leaks into your brain. It's critical emergency. A study of 84,000 hemorrhagic stroke patients found something shocking. Patients who arrived dehydrated had a 13% lower chance of dying in the hospital. Being low on water actually improved survival rates. In patients under 65, mortality dropped by 19%. Same dehydration. Opposite effect. Here's the key question. How could the same state of dehydration be poison on one side and medicine on the other? The two strokes have opposite treatment goals. The clogged pipe needs blood thinned somehow to restore blood flow, while the leaky pipe needs the opposite, stop the bleeding and lower the pressure at all costs. So that dehydration state that was worst for the clogged pipe paradoxically helped the leaky pipe by naturally lowering blood pressure and reducing brain swelling, potentially slowing the bleeding. In fact, doctors also use special drugs like mannitol or hypertonic saline to pull water out of the brain when treating brain swelling. Dehydration created a similar effect. It's a perfect case where one side's poison became the other side's medicine. Now, here's a really important point. Don't get this confused. All of this discussion is about analysis of truly extreme emergency situations. Treatment after a stroke occurs is a complex medical domain that requires extreme precision from medical professionals. Patients can't control their own hydration status during the acute phase. Here's what matters most. You can't control emergency treatment, but you can prevent strokes through daily hydration. Large studies of adults over 80 show dehydration dramatically increases the risk of all types of stroke. Ischemic stroke, the clogged pipe, 1.98 times higher. Mini strokes, TIAs 2.88 times higher. Hemorrhagic stroke, the leaky pipe, 3.99 times higher. Here's the key point. While dehydration might help hemorrhagic stroke patients survive in the acute phase, living in a chronic state of dehydration can trigger hemorrhagic stroke at nearly 4 times the normal rate. So what we can control isn't what happens after a stroke hits. It's preventing the stroke itself, and the most reliable way to do that is maintaining adequate daily hydration. As we age, the total water stored in our bodies decreases, our ability to feel thirst declines, and our kidneys' ability to conserve water weakens. Plus, if you're taking diuretics for high blood pressure or heart disease, your dehydration risk goes even higher. Recently, research is being done on checking hydration status in real time using something called salivary conductivity. In one study of acute ischemic stroke patients, some showed a drop in salivary conductivity of more than 20% after IV fluids. Their early recovery rate was 37%, compared with 10% in patients without this drop. So how much water is enough? This simple chart on the screen shows a daily target you can aim for. This medical paradox teaches one lesson. There's no universal good or bad, even with water. Everything depends on the situation and context. There's no such thing as a cure-all. But this is certain, preventing stroke is in your control. For our normal, healthy daily lives, drinking enough water is definitely the most important and reliable way to prevent terrible things like stroke. That's an unchanging fact. The glass of water you drink today could determine your brain health 10, 20 years from now. The question is simple. Is your daily water intake enough?